So next move on to the next speaker, Dr. Zainal Aripin Zakariah, who is the former president of Malaysia Homeopathy Medical Association in the tenure 1993 to 1998. He was the fellow of Persatuan Perubatan Homeopathy Malaysia from 1997 and founder and innovator with Vital Force Enterprise, obtaining three homeopathic clinics, the three homeopathic clinics at the moment across Malaysia, and with 3 registered products with the Ministry of Health and Higher Education, currently holding about 30 products in formulation. So ladies and gentlemen, may I now ask and invite Dr. Zainal Aripin Zakariah to deliver his speech.
No, I don't need that. Well, while waiting for the computer, let me introduce myself. By training, I'm an engineer. You call me doctor, you call me professor, it is in engineering. Well, Mr. Ramesh talked about the wave. I understand the wave very well. In electrical engineering, we talk about waves, something that you don't see, but it is working. And when the Prof introduced the cartilage and all those things, I interpret it from the engineering point of view, the friction. So that's how I practice my homeopathy. I use the electrical knowledge, I use the engineering knowledge to understand what is going on in the body. So, you may find a little bit difficult because homeopathy is, the concept is different, slightly different. Anyway, thank you, Mr. Chairman. And Prof. Ramesh, and Dr. Podang there at the back. Homeopathy has not been introduced in this university. So some of you may not understand what it is. It is a system of medicine founded more than 200 years ago. by a German professor of medicine. He was an MBBS doctor. He founded that more than 200 years ago, and now it is spreading quite fast and very popular in India and Pakistan. Because the two colleagues there, I have to be a little bit careful in my presentation, because homeopathy and allopathy, MBBS system of medicine, we call it allopathy, and homeopathy, they do not walk alongside each other most of the time. But with some very open-minded people, we don't have problem. So we understand this is my system, you are with your system. The ultimate is we are going to Kuala Lumpur. You use the train, I use the car. Finally, we will reach Kuala Lumpur. That's the most important. Okay. Yesterday I called Dr. Poda. He told me you are given about 20 minutes. So with that 20 minutes, I reduced all my slides to 4 slides only. But there will be a lot of discussion, I think, because you don't know, this is the first time homeopathy being introduced to you. Certainly you will have a lot of, if you have, some questions to ask, I'll be too willing to answer them. I have been in homeopathy for the last 38 years. Last 38 years. Now I have opened more than 10 clinics. Finally, I maintained 3, 2 in Malaysia, 1 in Indonesia. So last week I just came back from Indonesia. So, to give you a picture how homeopathy works, I have to show you a few examples of the remedies, the medicine. You call medicine, we call remedies. It means the same thing. In terms of the number of remedies, homeopathy at the moment we have more than 8,000 remedies. 8,000 remedies. So, when a patient comes to you, you must be prepared with these 8,000 remedies and must be able to interpret it. So, to show you how it works, I take one example. Of the remedy. Okay, anyone will do. Okay, you see that homeopathic remedies, you take for example, ginger is one of our remedies. ginseng is one of our remedy. No. How the remedy works? It starts from your head. The mind actually is the first one. The mind. It affects your mind. And it affects your head. Then the eyes. It goes down. It starts from up here. The mind, the head, the eyes, the nose, the ears, your mouth, teeth and so on. Goes down to the extremities. So whenever a patient comes to see you, they complain of, say, a certain complaint, a headache. You have to interpret that and align that to the remedies. Now, imagine you have 8,000 remedies and a person comes with headache. You have to align that and give that person the right remedy, one remedy. That's how it works. Then to come to that is, so you go to head, how the head will, take for example, I give you, I don't bring my hand. Okay, this is the ginger. We go to the ginger. Okay, I choose here one ginger as a remedy. Now this one is a little bit short. They don't go to your mind. It goes to the head first. Then how it affect the nose? They got certain characteristics which you have to study in detail, understand it. Then it goes to your stomach. It has effect on your stomach and your abdomen. Then urinary. Then for the males. Then the respiratory and your extremities and the relationship with other remedies. Then of course, what is the dosage you should give? Now, this is important because unless we understand this, it's difficult to go on. I'll give you another one. Okay, this is a big remedy. I'm trying to. Nux vomica is our polyclass. It's a main remedy in homeopathy. And you see, this one, it has the mind. It has effect on your thinking, your mind. Then it can affect your head, what is in the head, pain, headache, and so on. Then your eyes, then your ears, how it affect your ears, your nose, your mouth, throat, your stomach, your abdomen, your stool, even your stool. Then your urine, the male, the female, respiratory, your back, your extremities, your sleep, whether you walk in the sleep, you wake up in the sleep, your skin, the fever, modalities. Modalities is how it changes with time and condition, and then relationship with other medicines. So all homeopathic remedies are tested and written according to this. Some of them who don't have a mental, they don't have a mind symptom, whereas some will have. All major remedies will have a mind symptom. So homeopathy, when you come, a patient comes and see you, they said, I got, we don't, another thing I have to remind you, we don't have names for the disease. For example, osteoarthritis, we don't have the such name. We don't have such name. But slowly people try to use it. I still hold to the basic principle of homeopathy. It's the symptom that counts, it's not the name. And a person comes to you, or when a patient comes to you, it's not the sickness that is important. You got the osteoarthritis, yes, we take note of that. The most important thing is how you take that, your mind symptom that comes with you. Some people, they got a very swollen knee. They don't care, they just walk. There is slight pain there. And that same swollen knee, you give it to another person, he'll be lying down and screaming. Have you met such situation? Have you met such patient? Some people, they met with an accident and broken bones and all the cuts. They just walk calmly to the clinic. So I just met with an accident. I think I've got broken hand and the blood's coming out. Very calm person. Another person with the same situation will be crying, yelling, asking for help, as though he's going to die the next morning. What are the differences between these two? One is a very calm person, he has got good control of his body. The other one has no control. Is it the sickness that is important or the brain that is important? You think about that. So when sick patients come to see you, you analyze the person in total. Not just the knee, not just the fingers, not just the joints. The total person. That takes time. Of course, we don't use equipment most of the time. Okay. Now, having introduced that, I go to the topic. I remember putting it here. I know where I put it also. Yeah, in the document. So you just put it. Okay. Seminar on osteoarthritis. Okay. I'll put this. No, handle. Just to show you some of the cases that I've seen. Okay. Okay. Lisa. How do I? Oh no, that doesn't happen. Now this is a case. Then I've got a severe case than this. This one you see already bad. I've got a severe case. Okay. This one. No. The picture is now. Okay, this one. This one. This is just the hands. You have not seen the other parts, the legs. That man who came to see me, he used slippers only. He can put on shoes also. So, and it's pain all the time. Pain all the time. And he cannot move. There is a restriction to the movement of the fingers and the walking also. He walk like a duck. Okay. No, it's okay. It's okay.
View. Slide. Full screen, yes.
This is the reason, some of the reasons why homeopathy doesn't give names to the diseases. Sometimes it comes in complex form. It got so many in one sickness. So what do you call that? Huh? First you call it hepatitis A, then hepatitis B, then hepatitis C, then until Z. As you go on with that. So homeopathy, we go by the symptom. How you feel. A person, just now I told you, the accident, one that walked calmly to the clinic, there are certain sets of medicine suitable to that person. The one that cries, as though he's going to die the next moment, that requires another medicine, another set of medicine. So, not only you have to treat the mentality of the person, the mind symptom of the person, you also have to treat the physical part of the person. Like this is, after a while, he was hoping, you know, he got the what they call proposal from doctor. He said the best is to operate. So the cost was too high, couldn't afford it. Then he came to me. Then after 3 or 4 treatments, he could bend that, but the swelling is still there. It can be done. What you do, you have to dissolve the crystals. That will be solved. Then it will come back. I've tried many cases already, especially ladies that go for the profession is swing. They have got this problem of this sometimes swelling here. Can be done, but it takes maybe 6 months, 1 year. But you go in steps, it will the swell will get will go back to normal, then can move freely. But of course, you have to stop that from coming back. Then the rest, I think Prof has covered that. Let me go to my 3 slides just now. Okay, these are the 3 slides. I forgot to bring my mouse. No problem. Okay. I think Prof. Rao has explained the whole thing and very elaborate, and even gave me some education. And Ramesh has done that very well also, and it helps me to shorten my. This one, okay. I think this is. I spent some time on this one, on this slide. That is the homeopathic approach for the treatment of osteoarthritis. We don't believe in, well, operation is the last option. Because once you operate, you also introduce damage. It is already damaged. You operate, you introduce damage, a new damage. So we don't quite believe in that. We try our best to give medication. So the healing process, it should be rapid. It is not going to take years or days to reduce the pain. It must be as short as possible. The pain, as far as the pain is concerned. Then it must be gentle. Then permanent. This is the part hard to believe, but can assure you, it's not just possible, it is there. The cure is permanent. Then the treatment process deal with, first, of course, you see the person comes in, you see the general picture of the person, the patient. Then you go to the specific thing, which part of you that's sick, for example, the knee or the fingers, the finger joints. Now, what is more interesting here, for example, you come in, let's say the fingers. I will ask you, when is most painful? When? It's not, sometimes not all the time. Even if it is painful all the time, when it is the most painful? Is it during the daytime, nighttime, during your rest, or when you are working? Sometimes we even go to the hour. Like asthmatic, for example, we go for the hour. Because asthmatic usually, they aggravate in the morning, 2 or 3 o'clock in the morning. But the moment we say, oh, it aggravates 2 or 3 o'clock, then it reduces from 8,000 remedies, it reduces to about 5. Then you choose between the 5. To choose between the 5, we go for other things. Because, remember, sickness, you got that, for example, the finger, you got the knee arthritis, osteoarthritis, for example. You pain there, painful. That is the weakest part of your body. The pain comes there. The pain always comes and it goes out of your weakest part. Remember that. It cannot be wrong. That means there are other weak parts of your body. So when people come with pain in the fingers and you reduce it to about 5 remedies already, now you have to choose one. Then you go round the body, look for how to eliminate all the other 4. You get only one. Normally people comes in pain, you look at the mental state. Look hard on the face. Sometimes they don't want to look at you. They just talk. You are there. He faces. He's facing in different direction. That gives you an indication of a remedy. A person will dare not look at you right on your face. So that reduce one remedy. Then a person who comes in, for example, he talk to you, it's very smooth, very gentle, all this thing. That gives you another remedy. So finally you are you are left with one remedy. You give that remedy, and to give that remedy, also you got strengths. Either you give mother tincture, very what you call the extract, the pure extract, or you give 1x, 3x, 20x, or even the 1000C. Well, you don't have to worry about the I'm using X or C, but in other words, whether you give very dilute one or very concentrated one. Normally people say the concentrated one has got is more powerful. Not in the case of homeopathy all the time. The more dilute it is, the stronger it is much. The effect is much more stronger. Okay. Now you go for the person comes in. You look at the person generally first. What I normally do is I talk and jokes with the patient first. Because when you joke, you know, he becomes, the atmosphere becomes friendly, then he lose some of his guts. But when patient come and see you, they have some protection, a barrier. If you don't break that barrier, how are you going to get information? Especially in patient like this, when people come with knee pain, whatever, one of the questions that you must ask from ladies, how's your menses? It's not an easy question to ask, Some people may ask, what has got my menses to do with this? I come with knee pain. But homeopathy look at the patient in totality. Your menses, for the ladies, play a big role in any sickness in your body. So, you look at a person, then after cracking a few jokes, it becomes friendly, then the barrier is down, then we can talk. Because it's not just information that it requires, something is not said. That is the reflection on the face, from the eyes. When a person talks, for example, he said, "Can I see your teeth?" You are not a dentist, but the teeth tell you a lot of information. So what you do is you crack jokes, make the patient laugh. The moment he opens his mouth, you see the teeth, tells you a lot of things. A lot of things. The teeth normally go very, the edge is flat, flat. There are something like the tooth of the edge of a saw. Have you seen it? Sometimes you can see some white spots on the teeth. That gives you indication whether that person requires silica or require calcium, Zakariah, and so on. And that has a good bearing on the joints. And of course, I told you that just now the circumstances. Sometimes the person when it comes, it requires a different medicine. Sometimes it's the time when it happens, it becomes more painful. And of course, after all this, although the mind symptom is very important, normally we take it last. And the dose will be minimum. For example, you have a high blood pressure. Some cases you have to take whole life. This is because you are topping it at the top. Just like a crack, you know. Being an engineer, I understand it very well. Any weakness, you don't go and repair it. You go to the design of it. You understand it? Any weakness in anything, structure, you don't go and just repair. That is just temporary. To overcome, really overcome that, you have to go back to the design of it. For knee pain, all these things, if you go just to repair it, then you have to be dependent on the medicines. Homeopathic way is you go to the root. Once cured, it's going to be cured for a long time. That is the method we are using. But it's not easy. It's difficult. Because to get to the root of it, you have to know that person 100%. And very few patients will let the barrier down 100%. There's something. The next time they come, so I forgot to tell you last time. You know, that what he forgot last time changes a lot in terms of the prescription. Okay. Like just now, the one that I showed you the hand just now, so, to clear the pain, I'm giving you just one or two remedies only, because the same sickness with different people will come with different remedies. No, very few similar sickness will come with the same medicines. So in this case, what I did was the uric acid first, to soften the what they call the swell. Then of course I give, well, I tell you the medicine so it's alien to you. Colchicum is an example. Colchicum is an example to reduce the pain. Colchicum. Some of this. Then of course now the fingers are stiff. To make it move a little bit, then you give calcarea floor. That will enable the movement a little bit free. There's some of the things lah. Then there are such things as rota and so on to give you. And then whatever remedy we give it to take it just like a what you call a tree. We go to the root. We don't go to the branches. You go to the root, it gives you a long-term cure, if not permanent. Okay, I think that's all I think I have for the moment. It was something new to you. Otherwise, you can spend a lot of time. Okay, thank you very much.